In the last couple of slides, you have looked at what hospital or healthcare acquired infections are. Going forward, let's look at how big this problem is. First and foremost, let us look at this problem across the globe. See, as I told you, the World Health Organization estimates that at any point in time, or at any given time, there are close to 1.4 million people worldwide who suffer from this hospital acquired or healthcare acquired infections. For us, we can say that 14 lakhs people around the globe at any point in time suffer from this healthcare or hospital acquired infection. And this problem also leads to an estimated 80,000 deaths every year. Every single year, we see 14 lakhs people who suffer from this healthcare or hospital acquired infections, and this leads to around 80,000 people dying just because they got infection within a hospital or a healthcare facility. So you have to understand that it is becoming a very big problem with respect to infections which people get from visiting a hospital or a healthcare facility. We go to a hospital or a healthcare facility actually to cure ourselves of any condition which we have. It's very, very unfortunate that you also get infections from those facilities or institutions where the conditions are extremely poor and infections can be transmitted. Not only you contract infections, but also staff working in those facilities contract infections from different patients. Isn't it such an irony that occupational infections are very common among healthcare staff, and especially in poorer countries or what are called as least developed countries or underdeveloped countries. And again, to tell you that the frequency of occurrence or what we call as the prevalence rates, like when we measure disease, we talk about how many people are suffering from a particular disease at any point in time. In epidemiology, we call it as the prevalence rate. So when you look at the prevalence rate or the prevailing rate, it's about 5 to 10% of all patients admitted within these facilities have this hospital acquired infections, where actually in the advanced countries, which means the advanced countries as well as the developing countries are not spared of these infections. Even in those countries, like for instance the Americas, Australia, many countries in Western Europe, United Kingdom, etc., even there, out of every 100 patients being admitted, 5 to 15 of them or 5 to 10 of them end up getting this infection. So it's not only a problem restricted to the poorer countries, but it's also a problem which you see in rich and very rich countries. Only the difference or the magnitude is different. Like for instance, like I said, in very developed countries, it may be 5 to 10%, that is 5 to 10 per 100. In least developed countries or developing countries, this rates may go up to 20 to 25, and that is what it says. So if you look at these slides carefully, and especially this slide where the portions are underlined, the last sentence says that the prevailing rates of hospital acquired infections in poor or developing countries is to the extent of 25%, which means 1 in 4, or which means 25 out of 100 people admitted within a institution get this infection. So it's a very big problem. Similarly, what is the problem which is seen in India? We don't have very accurate estimates, but from all the information which has been collected or collated from different parts of the country, we find that the prevailing rates of hospital acquired or health acquired infections in India is to the extent of 7 to 18 per 100 patients. So if you really look at it, it is double of what you see in very advanced countries. So, we are not very bad, not very good, but we are in between, which also demonstrate that we are an emerging economy. We are not a developed economy, we are not a developing economy, but we are in the middle, somewhere in the middle, and these infections also reflect. So, if you go to any city today, you see hospitals and healthcare institutions mushrooming everywhere. So, the chances of people going to these institutions, whether it is public or whether it is private or whether it is voluntary, is quite high. People come from the rural areas, come from difficult circumstances, etc., into hospitals with the cities, etc., and even our hospitals are fully packed. Just like our film theaters are packed, even our hospitals are becoming packed nowadays, and that is why it's important to understand that you have quite heavy load of this hospital or healthcare associated infections even within our country. So, we are in between. We are not developed, we are not underdeveloped or least developed, we are emerging. We are becoming, or it's going to become a bigger problem if we leave it to flounder, just like it is going to be now. This is a very nice illustration which I secured from the Sanjay Gandhi Postgraduate Institute of Medical Sciences, which is based in Lucknow. If you look at this slide very carefully, like I said, at least 18% of all patients admitted into hospitals get this infection, whereas globally it's 8%, within the country it is 18%. So, if you look at it again, why these infections occur, you see that nearly 50% or more than 40% is because of infections of the urinary tract. Those are called as urinary tract infections contracted within institutions. Another quarter, another 25% is because of infections which occur at the site of the operation, which are called as surgical site infections. About 7 to 10% are because of the bloodstream, where the infection is spread all across the body. We call it septic or septicemia. When you say septic, all of you understand what is septic. Septic means the infection which has spread in the blood all across the body. When that happens, it happens in about 7 to 10% of all these hospital acquired infections. So, these are what are called as proportions, right. So, if I look at a cake, the cake is 100%. So, half of the cake is because of urinary tract infection, 1/4 is because of infections at the surgical site, about 10% is because of those bloodstream related infection. And also nowadays, you see almost in all the healthcare facilities, there is the use of what is called as this artificial breathing or ventilator assisted breathing. You can also contract pneumonia, the infection of the lungs, through these ventilators. Let me tell you, premier institutions like the All India Institute of Medical Sciences in Delhi, or the Sanjay Gandhi Institute, or the Postgraduate Institute in Chandigarh, or the JIPMER in Pondicherry, even they have quite a big load of hospital acquired infections. You have to understand, these premier institutions are what are called as referral institutions. When I say referral institutions, lot of people from all parts of the country go to these premier institutions. So, the tendency to contract infections is huge, and these infections actually spreads because people with different conditions come to such facilities. Whereas, I do not think so this is surprising at all. If you look at government facilities, the government facilities or the public facilities, the chances of infection is very, very high. The reason it is very high, I do not have to tell you the reason. You understand that, like for instance, if you go to a Gandhi hospital or an Osmania hospital, or if you go to a sort of public facility, some say government general hospital in Chennai, or if you go to Odisha in Bhubaneswar, etc., people and people and people, teeming with people, because free care is provided for the population, we are a welfare state, etc. So, the chances of contracting infection also increases in such kind of facilities. Just to tell you, like I was telling you earlier, that this infection is not limited only to people or only to patients who go and get admitted within the facility. In India, it is also a very big occupational hazard. Occupational hazard meaning it is also an infection where it is spread from one patient to another patient by virtue of the staff working there. Like for instance, I examine you, then without proper washing my hands or sterilization, with the same hands, I will go and examine another patient. Because of the numbers of patients and the urgency of the situation, sometimes you will compromise. You should not compromise. You tend to compromise because everybody is important, and when you are working in a very, very high risk facility, or when you are working in facility which is where you have a lot of people, where a lot of patients, you have a tendency to shuttle between patients, and that is why staff are also responsible for spreading infections not only from patient to patient, but also from patient to themselves. I told you some precautions like not washing your hands between patients, or practicing hand disinfection, like for instance washing your hands with soap and water or disinfectant, etc., or not complying with the standard recommendation. I am very sure if I ask you how long should you wash your hands, how long should you sort of rub your hands, and how much what kind of water should be used, etc., etc., most of us wouldn't know. It's also a fact that people working in such facilities are also sometimes compromising on those kind of things. So this poor compliance may be because of things related to very quick sort of turnover, or it may be related to lack of awareness. And also sometimes it's an attitudinal problem in facilities, among people as well working there, organizational attitudes, like for instance, let us cut cost. You can cut cost, but where you need to cut cost, you should cut cost there, not in things like washing your hands or using disinfectants, etc. Sometimes there are logistical barriers as well, like for instance, water is a big problem for us, availability of supplies is a big problem for us, maintaining sterilization in public facilities, etc., is quite a big problem for us. So you have to understand this healthcare acquired or hospital acquired infection is also a problem within staff who are working, or people or healthcare workers who are working within the facilities. Now, just to reiterate again, why do these healthcare or hospital acquired infections occur within our country? It occurs because of negligible or poor infection control mechanisms. It also occurs because the facility itself is a high risk facility. Like I told you, the turnover is very, very high. There are, very quickly you need to actually admit patients and discharge them, admit them, discharge them, etc., etc. So this becomes a very high risk facility if you're not in a position to actually ensure sterility of that facility. And also because of regular and frequent use of what are called as these indwelling devices. Indwelling devices means, like I told you, tubes which you put, or the bloodstream, like for instance the saline drip and all those kind of things. Most often than not, this is also the reason for infections. And you also have very poor hygiene, sanitation facilities, and another thing which is happening within this country, because of the easy availability of medicines, like for instance, I can go to any pharmaceutical shop and I can ask him to give the highest sort of most expensive antibiotic without a prescription, because of the easy unregulated use of what are called as over the counter medications. Over the counter means just like you can buy a kilo of rice in a supermarket, or dal, or pick up vegetables, you can also pick up medicines. And what medicines these are? Antibiotics. Do you use them fully? You don't use them fully. You take a little, then you feel very comfortable, then you forget using it, and what it does, the organisms become resistant to this. Sometimes we have seen antibiotics which are used in poultry practice, like for instance, if you want the hen to give good eggs, what you do is you give them antibiotics. So this antibiotics was also responsible for creating resistant organisms. And if this resistant organism, when I say resistant organisms, organisms which do not respond to treatment like the antibiotic, this spreads, and if this spreads from person to person or within a healthcare facility, then we are doomed. The number of people dying because of this will also increase. At the same time, I think we also have to recognize that we have very limited laboratory facilities, diagnostic facilities, etc. So, if you put all of them together within the country, you have quite a big problem with respect to what causes this hospital or healthcare acquired infections.